Test, 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 test. Faiz, real quick, can you hear me from the speakers? Can you hear me from the speakers? And it's definitely from the speakers and not from me directly. Is it definitely from the speakers and not from me directly? Okay. Oh no. Oh, wait. What is? Hello. Hello. Test. Hello. Okay. That's fine. I think. Test. 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 Test.
Bismillah. Bismillah.
الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن محمد رسول الله حي على الصلاة حي على الفلاح قد قامت الصلاة قد قامت الصلاة الله أكبر الله أكبر لا إله إلا الله.
سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر الله أكبر سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر الله أكبر سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. استغفر الله العظيم مدينة. استغفر الله العظيم مدينة. استغفر الله العظيم مدينة. لا إله إلا الله وحده لا شريك له له الملك وله الحمد. اللهم أنت السلام ومنك السلام عليكم السلام علينا. دخلنا الجنة دار السلام تبارك وتعالى. سبحان الله سبحان الله سبحان الله سبحان الله سبحان الله. سبحان الله العظيم والحمد لله. الحمد لله على كل حال. الله أكبر. الله أكبر. الله أكبر رحمه كثيرا. سبحان الله وقدس. لا إله إلا الله وحده لا شريك له. بسم الله الرحمن الرحيم. الحمد لله ربنا لك الحمد كما ينبغي لجلال وجهك. صلاة حسنة صلاة تنجينا من جميع أهوال الآخرة تقضينا من تبلغنا بصر وعلم خير من حياتك خير ما سألك من عبدك رسولك محمد صلى الله عليه وسلم. نستعينك من شر ما استعان وأنت المستعان عليك ولا حول ولا قوة. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة. صلى الله على سيدنا محمد. الفاتحة.
Google. Could that be so? I can't find it. It's a sound. What is that? I forgot what that was. It's not VGA.
Any video is
No, none of them are VGA. If you do this wrong, you honestly could just fry the PC. Laptop. That's definitely a visual. Oh no, sorry, that's power, not visual. Yes, that's power.
Look, ini.
Yeah, that's power. That's supposed to go into power.
Masih terbiasa dengan waktu apa GMT. saran saya buat host pakai yang ini karena ini ada kabelnya. Yang ini terus saya nyalakan tapi gampang. Ini buat audience. Ini sebenarnya nggak kedengaran, jadi kalau kita bicara sini suaranya nggak keluar dari speaker. Iya. Atau
cuma ini doang.
nah ini sebenarnya masih diperlukan buat orang yang
Mau nanya dari situ ya?
yang live streaming. Sorry, orang yang nontonnya dari rumah. Nah,
yang mana?
Yang ini. Ya sebenarnya dua-duanya sih. Pokoknya suara yang masuk sini dan masuk sini itu nanti masuk ke YouTube.
Oh oke, berarti bisa sebenarnya.
Bisa.
Okay,
Cuman yang ini suaranya nggak keluar dari speaker. Sementara yang ini iya.
Oh jadi untuk orang yang di sini.
Orang di sini.
Berarti, oke fine.
Tapi
kan cuma dikitan, jadi nggak masalah.
Oke, tapi intinya buat ini saran saya ya, host pakai ini, pendengar pakai ini.
Oke.
Gitu aja.
Iya. Nggak, itu kan nanti kalau menjadi kayak talk show-nya jadi bisa di-pass on aja.
Iya, ini aja, ini pas. Meskipun nanti suaranya nggak keluar dari situ, tapi
Nggak apa-apa.
pakai aja.
Kedengaran.
Iya, supaya kedengar dari rumah yang nonton dari YouTube.
Abis itu ini harus di sebelah mana? Duduknya berdirinya yang bisa di
Pokoknya kameranya itu. Jadi asal kameranya bisa lihat Budia. Jadi sini juga masih kelihatan. Bahkan sana juga kelihatan sih. Pokoknya hampir semua.
Berarti di zoom in atau gimana?
Iya, saya zoom in.
Oh iya, berarti udah itu ya. Oh fine.
Ya.
Ya.
Ini saya ngambil buat audiens.
No, I'm not singing. I don't need the voice then.
Ada yang mau ditampilkan? Both of these work, but you can only hear this through the speakers. But we need this as well for people listening at home. So the host, whoever speaks, uses this. Audience uses this. That's it.
I mean for the other speakers as well, because like there's three.
Do you need another one? I can.
We'll just pass the mic around. Okay, thank you.
Because like if they like on it and think that it doesn't work, just
Yeah,
tell them.
I will do. Take some test pictures now. Zoom. Hold it. Oh. So this is to zoom.
Yeah.
This is to focus. So if you look through the viewfinder,
right.
sometimes if it's out of focus, you have to kind of play
Yeah,
around with
yeah.
that.
Oh, it's just like a microscope.
I'm good for now. It looks pretty scary. Maybe if your mom wants it, ask her.
I saw. So if it's so how do you like?
So I think we'll just go back to Marty. Okay, everyone, we're about to start in 2 minutes, so if you could all just gather around.
Oh.
I think, yeah, just cue, and then. I think just use the no flash setting then.
Okay.
This one. Yeah. Aisha, do you mind starting this? Yes, Sonia. Okay. Assalamu'alaikum warahmatullahi wabarakatuh. Thank you all very much for being here and for attending the Kibar Youth Medicine Seminar. We would like to inform you that this event is being live streamed and is being recorded. So I'd like you all to please just look at that camera over there and wave at it. Thank you very much to the man in the control room, Mas Alpha, who is live streaming this, and we will be sure to give you the link to the recording afterwards as well. So before I hand over to Dyah, I just have a few words to say. So I hope you are all looking forward to this seminar. But I personally am very excited for this for two reasons. The first reason is because medicine is a very noble profession. And we are very lucky to have Dyah here, who is willing to lead this seminar. And this brings me to my second reason, which is that one of the highlights really of my tenure as president of Kibar Youth is that we have a new focus on career development, or indeed for those of you who are still students, to figure out what career you want. And our very first career event was the tech tours at the Google offices in February this year. It was a success, alhamdulillah, but Kibar Youth does not rest on its laurels, and so we are very pleased to bring to you today this medicine seminar, which will be led by Dr. Dyah Prawesti, consultant obstetrician and gynecologist at Milton Keynes University Hospital, and she will be joined by three wonderful speakers. We have Hania, is that right? Hani. She is a practicing physician. We also have Alia, a postgrad medical student, and we have Sandra, a medical student. Before we start the seminar, we would like to open it with Tilawa, which will be read by myself. So I will be reading Surat Ar-Ra'd, ayat 7 sampai 11. And these verses of the Quran are very special to me. I read them as I was studying medical law at university. And so I believe that they are very appropriate for us to listen to today. So here goes. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الله يعلم ما تحمل كل أنثى وما تغيض الأرحام وما تزداد وكل شيء عنده بمقدار عالم الغيب والشهادة الكبير المتعال سواء منكم من أسر القول ومن جهر به ومن هو مستخف بالليل وسارب بالنهار له مؤقبات من بين يديه ومن خلفه يحفظونه من أمر الله إن الله لا يغير ما بقوم حتى يغيروا ما بأنفسهم وإذا أراد الله بقوم سوءا فلا مرد له وما لهم من دونه من وال. And then the translation for this is Allah knows that which every woman bears, and that which the womb absorbs, and that which they grow. And everything with Him is measured. He is the knower of the invisible and the visible, the great, the high exalted. Alike is He who speaks out loud, and he who does not choose to reveal what he says. He who lurks at night, and he who goes freely in the daytime. For him are angels ranged before him and behind him, who guard him by Allah's command. Allah does not change the condition of a people until they first change what is in their hearts. And if Allah wills misfortune for a people, there is none that can repel it, nor do they have a defender beside him. Sadaqallahul Azim. So without further ado, I am now going to hand over to Dr. Dyah for her to start the seminar.
Thank you, Kak Adiba, and thank you. What a beautiful recitation just now. And as you said, it is very relevant to all of us, inshallah. Assalamualaikum warahmatullahi wabarakatuh. I think I'm just gonna say it, okay? And I'm gonna straight to, because I think we're running a bit late, I'm gonna start to call all of our speakers today. So if I can call Sandra. Sandra is a first-year medical student. Come, we're just gonna do it as like a talk show thing. So I'm gonna call everyone so that we can just basically chat informally. And if any of you who's in the audience here at the ICE have any questions, please do ask there and then. Yes, Raisa has got the microphone, so Raisa will pass that on. And if anyone who is joining online from the YouTube, if you do have any questions, please do put it in the chat box of the YouTube channel, and then we'll pick it up, and then I'll read the questions to our speaker, okay? So we've got Sandra, our first speaker. Sandra is currently first-year medical student at Brighton University, is that correct? Yeah. And I've got the next one, Alia. Come, Alia. So Alia is, what year are you, Alia? I'm like lost count now. 4th year. So Alia is a 4th year medical student at the University of Leicester. And the last, but obviously not least, we've got Hani. So Hani is actually Indonesian graduate. So Hani graduated from Pajajaran University in Bandung, Indonesia. She finished her undergraduate degree there, completed her. Did you do co-as or did you do internship? What did you do? Internship. She completed her internship there and then moved to the UK, underwent all the process to register to practice medicine in the UK. And she now works as a psychiatry trainee. So Kak Hani already doing her specialty training, and she does psychiatry. Okay, so we will go into how she did that and why she does what she's doing at the moment. Okay, now, so I believe a quite significant of our participants today in the audience are our youth who are probably aspiring to be a doctor, probably considering to get into medical school, or probably have no idea or doesn't want to go to medical school, and I am trying my best to sway you all to apply for medicine, okay? And because, as Kak Adiba said, it is one of the profession that I think also not only give you the satisfaction of getting all the thing that you want in the world, in the dunya, but also lots of opportunity to gain more rewards in the akhirah as well, inshallah. Okay, so without further ado, I'm gonna ask the first question to everyone. Okay, so just to give idea to everyone who is probably aspiring and considering to become a doctor, what was the reason for all of you to choose medicine as your career pathway? Yeah, so you've got 1 minute to answer that question. Start from you.
Okay, so hi, I'm Sandra. I chose medicine because I actually really liked the academic side of it to begin with. I really enjoyed sciences in GCSEs and going into A-levels. I also did tutoring where I did a lot of communicating with students, and that's something that I wanted to involve myself in the future. And I felt like attending also a lot of medicine talks hosted by my school gave me a lot of insight to the different specialties and role as a doctor that I was very, very interested in. I also gained a few work experiences where I was able to have real-life patient interaction as well as interactions with doctors that gave me, that really urged me into really wanting to go down this career path. So all those factors involved really helped me be on this path.
Thank you.
Okay. Hi, my name's Aliyah. I'm 4th year medical student. So I chose medicine because, well, I always really wanted to do medicine. I've always liked being around people and sort of like being in a position where I can help other people. But I also wanted something that was quite cerebral. But I had like my options open. So I liked science, so I tried stuff in the lab and like, but I thought I really liked sort of the patient interaction that's involved with medicine, and I also managed to get some experience. And when I was in the hospital, I noticed that like there's really nothing like healthcare, like working in healthcare, and it's just really exciting, and also it's very challenging, but it's very rewarding as well. So that's why I chose medicine.
Yeah, hi everyone. I'm Hani. I'm psychiatry doctor. I'm training in forensic psychiatry. So that's always a challenging question for me because I don't really know why I want to be a doctor, even until now, why I chose this specialty field. So, but I think for me it's more related to my personal experience when I was very young. So my family background, they are all solicitors, so no one in my family is a doctor. But it's more like when I was young, my father was really sick that he needed to go in and out the hospital. So since I was like 6 or 7 years of age, I didn't have, so I always want to be a doctor, just want to help my family. But since then, whenever like any people ask me what you want to do in the future, I just said I want to be a doctor. But I think it's more like personal experience. But now I feel like I still don't know why why I want to be a doctor, but I think it's more a rewarding job that I feel like I just feel happy when I do it. So, yeah.
Thank you. So, I would like to make a bit of some bullet point or conclusion from all of your answers, okay? So, I think Sandra and Aliyah said they love sciences. Okay, and yes, to be a doctor, you have to have a background science. Well, you don't have to love it, but you have to do sciences in order to be a doctor. Okay, and I as Aliyah and also Sandra said that going into medical school also give you the opportunity, and in the future, not just when you're in the medical school, also give you the opportunity to actually, if you want to go down the route of become a scientist, do lots of work in the lab and be a researcher in the future, medical school would also accommodate that as well. So you don't have to be a doctor as in a clinician to see patients, but you can always choose later on if you want to become a scientist or researcher in the medical field or in a science field. So it is an option, isn't it? And number 3, all of you said that human interaction, so interacting with other people, is one of probably the most important thing in medicine, okay? So we all say that these days we've got the AI, isn't it? Everything can be done by AI, including probably diagnosing diseases, deciding treatment plan. Probably AI would do much better than human because that takes off all the human errors. But one of the things that AI and robots doing surgery, all those things, one of the things that they cannot take out from the medical profession is the human factors, the human touch, human and human interactions. Yeah, and obviously, one of the benefits, obviously, as you said, it is a very rewarding profession. You feel that you change people's life day in and day out every day. So that is one of the things that that's the perk of doing medicine. Okay. Now the next questions, Sandra. So I think lots of people wants to know how you get into medicine. How did you do it? What thing that you prepared before you get into medicine? What the process are, and what sorts of tests that you have to cover, and how the selection, how did you find out that you get into medicine, that kind of thing. Would you mind?
Yeah, sure. So I first did to start my medical application was to research the medical schools throughout the UK and which one, because they all had different requirements, such as taking the 2 medical tests that you have to take to get into medicine, which is the UCAT and BMAT. So when I applied, there was an option of doing both, but I am aware that in the next round of applications is only the UCAT. But first of all, I did research on all the unis, and I kind of focused on my priority. I focused a lot on Brighton and Sussex because I did that university really stood out to me. So I prepared for the BMAT alongside UCAT to give me a bit more options and flexibility of which unis I can apply to. So I started my preparation in the summer of year 12 and took the tests, I believe, in September and October. And I used for the UCAT. So for the UCAT, I would say I used Medify, which is quite a platform that a lot of people might use to practice UCAT questions. It's very, very similar to the questions in the exam, and it's able to track your progress so you can see any improvements. So that's what I used it, and I used it quite consistently up until my my test. Alongside this, I did the BMAT, which is a very different I would say exam. It's a lot more of focus on using prior knowledge on your sciences and your academic writing, and I did both of them in October. I would say that when I first started year 13, it was a lot of an overlap in between of doing my UCAT and my BMAT prep, as well as doing my UCAS application, where I had to write my personal statement, which I was able to be supported with my sixth form team in writing that. And in my personal statement, I included some of the work experience that I gained over the summer, which was it was very beneficial and very useful in having quite an insightful perspective on what medicine is and what I can include in my personal statement. And I believe, I think that's it. Yeah, I did my BMAT after applying to my universities, because that's how the layout was in when I was doing my applications. And yeah, that's how
So I had a bit of a different route to enter medicine. So I did a degree first, an undergraduate degree in biomedical science, and then I applied for medicine after I did my undergrad. So I have a bachelor's already, and then I applied for medicine. The steps are kind of the same as Sandra's. So you have to do like UCAT or BMAT, which is like like their aptitude tests. You need to get good grades. That's the same like for anyone going into medicine. You need to have good grades, and every applicant will have good grades. Then you also have a personal statement, which is you have the right about why you want to do medicine, and you need to have and for all of this you should always have work experience. Most universities will want you to have work experience, at least a couple weeks in a hospital, and then a more prolonged work experience in a different place, like maybe a care home, or basically any sort of role where you're facing other people and sort of doing something voluntarily, because basically the unis want to see that you're like a caring person and that you are quite like resilient. And then there's also an interview stage, which is like you sit in front of the medical school, and then you tell them about your motivation and tell them about the preparation that you've done to try and get into medicine. So those are the main steps. But because I'm a grad student, I have a bachelor's degree. But your bachelor's degree, if you want to go down this route, you don't actually need to do a science degree. You can do any other degree, and as long as you have good grades and you've done the work experience, you can still get into medicine. And I also have friends who are like, you know, in their 30s or 40s, and they're just starting medicine. So you can actually start at any age, really.
Is it the same question? Yeah, maybe it's not relevant for me, but because I did my medical degree in Indonesia, and long time ago, we call it SNMPTN, Seleksi Nasional Masuk Perguruan Tinggi Negeri, like you need to apply for the national. But it's just more my journey after. So I did my medical degree in Indonesia, finished the internship or equal as FY1 doctor here, foundation year 1 doctor. And then a year after FY1 is equal like foundation year 2. So I did internship, and then I did 1 year post-internship, which is equal as FY2. And this 2 years experience makes me eligible to apply for the specialty training here. So I did all the route with PLAB exam and everything until I secure my place here.
Thank you, everyone. So probably again, just to summarize, I don't know whether, do you have any questions? Do you guys have got any questions? No? So just to summarize, especially for our audience online who is not in the UK. So the UK medical training system, as well as the healthcare system, slightly different to Indonesia. So if you're in Indonesia, probably it's not as relevant, okay? But I think the basics are the same, but the recruitment exam or the exam to get into medical school, different, slightly different. Well, not slightly, probably completely different in Indonesia. So just to give you an overview how medical training and working as a medical professional in the UK. So in the UK, you would go into medical school for 5 years, is that correct? Is it still 5 years? Yeah. After your A-level, you would apply to medical school, and then you will be in the medical school for 5 years. Now, that is probably a downside in comparison to other degree, where like Kakak Alia, she did another degree before she get into medicine, and took you 3 years, isn't it? So I think most of other degree in the UK takes about 3 years. But the beautiful thing in the UK is, even after you do a degree, or even after you work, even in your 30s, 40s, even 50s, if you still want to go to medicine afterwards, there is no age discrimination to get into medical school. So even bapak-bapak here, if you still want to go to medical school, you are still eligible for medical school, okay? So I think that's also different in Indonesia. You're not allowed to. In the UK, you can go straight to medical school without needing another degree. Kakak Alia did it by her choice, okay? unlike in the US, that medicine is actually a postgraduate degree. You have to have a degree, undergraduate degree first before you can apply to medical school. Not in the UK. You can go straight from A level. Okay, so that would be 5 years of medical school, and then you complete, graduated. Okay, and then you will need to register with the what we call as a medical regulatory body. So every nation in the world, every country, they will have what we call as a medical regulatory body. In the UK, it is called General Medical Council. In Indonesia, it is called Konsil Kedokteran Indonesia. So every country will have that. So you will need to be registered with them in order to be able to practice medicine in that particular country. Okay. So in the UK, once you finish, you will need to register. So you will get a provisional registration first. As soon as you complete your medical school, you get provisional registration, and then you will need to apply for your next training, which is what we call in the UK, it is called foundation year. So it'll be 2 years of foundation training. That's foundation year training year 1, and then the next one would be year 2. Okay, so after you finish the foundation year 1, you get a full registration with the GMC, and then you can do your foundation year training the second year of it. Okay, and then completed the foundation year training. Now people ask me, do you get to pay for your foundation year training? In the UK, you will get paid. Okay, so you will get salary. Whilst you do your training, you'll get a salary. Probably the same in Indonesia as well. If you do internship, you'll get a salary as well. Although being paid or not being paid, that's a different matter. Oh, I shouldn't have said that, but anyway. And then afterwards, in the UK, after you completed your foundation year training, and then you get the is it certificate of completion of foundation year training, isn't there? Yeah. You then are eligible to then apply for a specialty training. Okay, so there are, I don't know how many specialty training there are in the UK. There are various specialty training that you can get to. Okay, ranging from the surgical specialties like surgery and and the branches of surgery, as well as the medical training and its branches. And you also can apply for a GP training. Yeah, so in the UK, GP is a specialty training in itself, and sometimes people from Indonesia sometimes a bit confused about Dokter Umum. Is different to GP in the UK. GP in the UK, they will undergo another training for at least 3 years before they will complete the training as a GP and can work as a GP. So it's not Dokter Umum in Indonesia where they just completed their medical school and become Dokter Umum. That's slightly different terminology. Yeah. So that's that, okay? And then in terms of specialty training, Kak Hani will give us more information about how to apply, okay? And also how from Indonesia you can come here and then have your specialty training in the UK. Unlike in Indonesia, because I did my specialty training in Indonesia and then I moved to the UK and then had had a more further training. In the UK, you will also get salary, a decent one. In Indonesia at the moment, as comparison, you will have to pay to be trained to be a specialist, but not in the UK. You'll get paid. Yeah? Okay? Great. So, next questions. So you've been in medical school for nearly a year, haven't you, Sandra? What are the things that you most enjoy in medical school, and what are the things that you hated the most?
So in my first year, well, nearly completed first year of medical school, I feel like one thing I really enjoyed about the school that I go to, this is for me personally, is the amount of opportunities and that I'm exposed to. There's a lot of different activities that we do throughout the week that is hosted by the school. So we have our regular lectures, but on Tuesdays we have clinicals, so we're able to have the support from GP facilitators that teach us how to take a history and examinations, which I personally enjoy because I enjoyed having that connection and that interaction with medical professionals. But also the societies that are held in medical school, it's very, very fun. There's a lot of different branches, such as there's sports societies, and there's cultural societies as well as like specialist societies, so there's a lot to get involved in medical school. I would say that one thing is it is quite a heavy degree. I would say there's a lot to do, but I would say that in terms of lectures, there's quite a lot of lectures, but and it's a lot to like get through, but with the right support, I feel like it's quite a nice degree.
So I really enjoy it so far. So I'm in my 4th year. I'm currently like on my clinical placement, so I'm in the hospital, doing stuff in the hospital. But I really like it, and I think a lot of it is because I'm in Leicester, so Leicester's kind of a small city, but you can feel like the community vibes in Leicester. A lot of the doctors that you will meet will have studied at Leicester, so they know exactly what your curriculum is like, and they really support you a lot. And a lot of the patients as well, they'll be from Leicester, and people in Leicester are very proud to have a medical school in Leicester. So the patients are normally very happy for you to, as a student, talk to them, and if they need like things done, they don't mind a student doing them, which is nice in Leicester. And also, yeah, it's just really nice to be able to meet lots of different people from different backgrounds, like people that I might not have encountered in my regular life. And in terms of what I dislike, maybe, yeah, it is quite intense, but I think that's the same for medical schools everywhere. And also, this is more for like, maybe you don't need to worry about it, but maybe for your parents, it can be quite expensive, like sort of the other costs involved in medicine. So if you study outside of London, you might need like a car to travel to like your placements, and that can be quite expensive sometimes. And also there's quite a lot of materials that you might need to purchase yourself. So your equipment and your like uniform, like different sort of study apps and software. Those are just some things to remember.
So I think for me, maybe I will need to modify a bit. I can't remember when I like in medical school, but I think it's more like in clinical practice as a doctor and as a specialist. I think one of the benefits of here being a doctor, especially in London when it's very diverse background, I have seen more than I think 15 nationalities with very different background, various background, that I feel like that's kind of like rewarding and enjoying, because like you see patients here from British background, you also see from somewhere there, which I haven't heard about the language before, like someone from Eritrea, and then he couldn't speak English, stuff like that. I was like, oh, okay, what kind of like, what's your mother tongue language? I need to arrange interpreter. So it's just, I mean, it's quite challenging, but it was also very enjoyable. And other thing is being as a doctor, at least for me, it's not like a kind of like boring job, like you just need to sit in front of the computer or laptop and do all the admin work, because you go, maybe first day you go to hospital and then second day you go to clinic, and you need to work in maybe different places, emergency department, then you go different places, hospital. Even for me, like because I'm doing forensic psychiatry, so I need to do a forensic assessment in prison. So I actually go to prison to assess patients and do the report about like murder or kind of like things within criminal justice system. So I feel like, I feel like I'm in the Netflix series as a, you know, kind of like detective series, stuff like that. So I think it's very enjoyable, yeah.
Thank you. So Kak Hani is doing forensic psychiatry at the moment. So she's dealing with, you know, psychopath and people like that. All within the criminal cases. So it is very interesting that Kak Hani started as a doctor, started to take training in psychiatry, and now she's doing that particular training, which is very interesting. Okay, so come back to Sandra and Alia. So people ask that, you know, the kids or the youth that goes to medical school, most of them are nerd, most of them are weird, most of them are like a bookworm. They don't have anything else to do apart from studying medicine. They don't get to enjoy their uni life. Is that accurate in your experience?
I think I would say it really depends on which uni you go to. I'm just saying this personally, but when I first went to, on my first few weeks, you definitely meet a diverse amount of people from different backgrounds, from different ages as well. So this was the first time I was really exposed to quite a lot of people, and I would say there's like varying levels, and there's people who for like really want to go out for the uni life, for the societies and parties, and some people that just kind of want to like just stay at home, which is perfectly fine. I sometimes do that too, but I would say that with university, it's sometimes like you really want to make the most of it. I would say with the medical schools, they really like do host some of the societies, so I would say definitely get involved, and you get to meet a lot of new people.
I would say, well, because my course, there's like 300 people in my year, so there probably is a percentage of people who are part of that stereotype, but I think for the most part, like, people are normal people, and yeah, everyone's smart, but they will have things that they do outside of medicine, and I think that's like the most healthy way to go through medical school, because it's quite intense. Like, you can't really be just so focused on medicine and nothing else, and also because there is an interview process, so they'll probably make sure that for the most part, they choose candidates who have like a good work-life balance and have other hobbies outside of medicine.
So I might be wrong, but it just depends on my personal experience. When I practiced as a doctor in Indonesia, and now that I'm practicing here in the UK, I feel like in the UK it's more like work-life balance. Like, you can't do anything you want outside hospital or outside medicine. While my experience when I was in Indonesia, it's quite, because like the demand was too high, and the workload and the working hours was like, I think that's quite high in Indonesia as well. So I didn't get that much opportunity, but in the UK it's more manageable, I think. But I might be wrong.
Okay, so you would say that is not a true stereotyping. It's people choice to do so, yeah. But you do still have time to enjoy life outside your medical school or outside your work as a doctor, yeah. And work-life balance, it is again life choices. Probably unlike again in Indonesia as a comparison, in the UK, even in training, you have the options to work what we call as a less than full-time, or training less than a full-time, okay? So if you want to work part-time or train part-time, you can. It doesn't have to be because you have family or young children that you need to look after, you can go less than full-time or part-time. So we call it less than full-time work in the UK. So you can do it because of choice, because you just want to do it, or because you want to do something else, not necessarily because of family commitment. Okay, so which is a good thing. Yeah. So the next, probably the next questions that a lot of people also ask is, once you graduated from medical school, do you have plan already, like in terms of what you want to do next? Or do you still want to see how you go and go into your placement, etc., before you decide? Lots of people already sort of like have got the idea that I want to be, a certain specialist, for example, or do you still sort of like open in terms of what your options later?
Sure. So because I have just started medical school, I am completely open to a lot of different specialties. I feel like I really want to experience what it's like to be in the wards and actually studying that specialty before choosing like a designated one. So I'm definitely looking forward to my placement years, where I'll be able to experience a lot of these different specialties and kind of weigh the pros and cons into what I want to enjoy and what I want to pursue. But as of right now, I'm still open to a lot of different specialty choices.
So I'm coming towards like the end of my placements now, so I've had a lot of exposure to different specialties. I quite like psychiatry or like pediatrics maybe. So hopefully maybe after medical school I can get into a training program, but I would like to also, when you're a doctor, you can, every country in the world needs doctors. So I would like to maybe go back to Indo one day, if that is an option.
I think for me, because I am more in specific training now, so it's like no other choice. But I feel like I want to do part-time PhD somewhere in the future, because gladly in the UK that's possible, that you are trained as a specialty training and then you take like PhD. And I'm more into teaching and research, just because that's one of my special interests. And hopefully after finishing all this training, I just want to focus as an expert witness at the court.
Great, thank you. So obviously Sandra is still open. Probably Alia has got sort of some ideas about what she wants to do next, but definitely yes, it is possible to go back to Indonesia. There are schemes that are being introduced now by Kementerian Kesehatan, the Minister of Health, for doctors who are trained abroad to go back to Indonesia and to work in Indonesia as well. And probably the other thing, probably another perks of completing your training in the UK, most of the Commonwealth countries, the Middle Eastern countries, they do recognize UK training certificate. If you completed your training here in the UK, that shouldn't be a problem if you want to then work abroad as well, especially in the Commonwealth as well as the Middle Eastern countries, which a lot of UK graduates do as well. Yeah. So that's that. The other questions that also a lot of people ask, especially when you're in your sort of first years of the medical school, you do lots of sciences subjects, and also you do also lots of laboratory works. You do probably also lots of doing the anatomy subjects as well, which back in my days, that was one of my least favorite subject, okay? Because I hate going into the lab and then had to go with the cadaver. Do you know what cadaver is? Yeah, and you need to basically dissect them, learn the anatomy, memorize all the bones, all the muscles, all the blood vessels name, all the everything, literally. Okay, how do you find it?
So with cadavers, that was actually one of the points that I really wanted to experience, and that's what the Brighton and Sussex Medical School was able to offer. So that was kind of, I personally really enjoyed it. I actually had my last dissection session yesterday, and I found that with like cadavers and dissection, I think it's a really wonderful experience. I was able to have hands-on experience, and I was able to really apply my prior knowledge from lectures of anatomy onto like a real life experience. So I found it really a rewarding experience that's really helped me with my understanding of anatomy.
Yeah, I had anatomy in first and second year. Yeah, it's difficult, but I think it also depends on your medical school. Like you have to, like if having dissections is something that's important to you. I don't think all medical schools actually do dissection. So if that's important to you, then make sure you choose a medical school with like an actual dissection room. Yeah, my one has a dissection room, and I think now like different medical schools might use different sort of tech to help you with anatomy. So some of them use like VR or like AR. So yeah, you can look it up if that's something that you're interested in.
Yeah, I think I remember I did that kind of like session anatomy class back in medical school long time ago. Yeah, it was something nice actually. But I think now after exam that I've gone through, I feel like it's more like we are learning by this all kind, not AI, but it's all the what is this like digital system like in anatomy, so like you can learn better through that. At least that's my experience.
Okay, good. Sandra, you probably want to be a surgeon then in that in that case. So the other thing that slipped through my mind just now. What we in medicine, obviously, you learn so many things, right? So you literally from the basic sciences, biochemistry, everything. But then actually, Kak Hani can testify that later on, when she practices and specializing in psychiatry, probably 80-90% of the topics that were learned in the medical school probably just gone out of the window. And I know some of the youths also argue that would be the same as well. You know that when you are at your secondary school doing GCSE, you do so many other subjects that are probably completely irrelevant with your future aspiration, career aspiration. Okay, but do you think we could modify and probably just get rid of all those irrelevant things? Or you would argue that actually learning all those seems to be irrelevant subjects is actually helping you in shaping your knowledge, shaping who you are now as a person? Or the third argument would be, well, we could potentially then try to modify the curriculum so that people can then just choose or limit the ones that they probably would think as relevant. And then yes, if at the end of the day, if it's not useful, they're gonna, kind of like go and throw out of the window anyway. What do you think?
I think with, I would say quite a lot of medical schools, they cover quite a lot of different topics in first year. I know that I cover very different topics to my friend who goes to a different medical school, but I would say only from like first year med student, we've been taught to kind of we need like a basic understanding of everything before it gets developed in the later years. There are a few topics that I find personally a little bit boring, but I guess that's kind of what the curriculum was made. I'm not too sure which I would want to cut down, but possibly like the content gets a lot more heavier throughout medical school, to the point that it gets a little bit, you kind of know what you want to end up going into, and I would say that's where you kind of find other topics a little bit more irrelevant. But I would say for first year, we would want like a basic understanding of kind of like a whole range before narrowing down our choices.
Yeah, I think my like in all medical schools, you kind of have to learn everything, and then probably when you specialize, some things might be less relevant. But I think it's good to know everything. I don't think, especially if you're coming into medical school straight from A levels, I don't think you can say when you're 18, like, I definitely only want to be like a heart surgeon and I don't need to know anything else. Like, people change their minds all the time. Like, some people like think they want to do surgery and then they change at the last minute. So I think it's good to know everything.
Yeah, I think for me, yeah, that's true. I mean, if you're later being a practitioner, then you just treat the patient, you treat the symptoms more rather than going back to biochemistry. I think I was only good just for the sake of passing exam, and then when exam is gone, everything's gone. But I feel like now that I'm doing kind of like some research, so I need to go back, look at it. How's the mechanism? What's the mechanism of a disease? Or for example, when facing situation that we've been treating these patients, but we don't see an improvement. So we need to look again at what's the mechanism of the disease. So it makes like we need to look through all this biochemistry or how the brain works or how the disease spreads, something like that. So having the basic knowledge is a must for medical students, whether it will be irrelevant or not. But at least knowing the knowledge will help us, definitely help us later in the future.
Good, thank you. So you all agree that all the things that seem to be irrelevant actually will give you some benefit, yeah? Okay, great. Is there any questions? Anyone want to ask questions? No? Okay, no? Okay, great. So I think it's 3:15. So if there isn't any other question, I'm gonna ask more questions, okay? So do you think, because we talked about how the advancement of technology might be a threat for a certain profession, okay? We know there are lots of other professions that are probably not there anymore now because of some of the technology had taken them over. Okay, do you think in the field of medicine, do you think what are parts of medicine that can be possibly in the future probably replaced by completely machinery and technology and AI and whatnot, and what parts of medicine that will still be there and will need a person to run the surface, if you like, yeah, so that we try to convince people, right, to go to medicine. We don't want people to then put off to say like, why would I go to medicine, because this profession will be like completely gone in the next like 20-30 years because technology will take them over. So what sort of field that you think will go, and what field that you think still be there, so that people can then be convinced to be a doctor is actually still will be needed. You will not out of job. That's the main thing.
Okay, yeah. So there has been a kind of a big development of AI and tech in the medical field. I'm not too sure on which specialties in particular, but I would say possibly one that requires kind of fast emergency procedures, possibly, because it could be because there might be a lack of staff maybe, and then we need like the operation or procedure done quite quickly, but I'm not too sure about that. But I would say a lot of the ones that will remain to be with like humans would be with human interaction type of fields, so possibly with like geriatrics with the elderly. I would say that they would need quite a lot of human interaction and a lot of a care as well, and yeah, that's all I can think of.
I don't think being a doctor is any more like at risk than any other profession. I think like if AI was going to take over like jobs, it's going to take over other jobs before medicine. But yeah, I think with like AI and stuff, it's going to be used to make our jobs easier. But I don't think they will replace doctors. Maybe they'll help out a lot in like I don't know, radiology or like pathology or something. But all the other ones that require actual like meeting a patient and problem solving based on like how they look in front of you, I don't think a computer's going to be able to do that.
For me, believe it or not, I have ever asked AI what kind of specialty that will be replaced by AI in the future, and what kind of specialty which will not be replaced by AI in the future. And the answer is quite shocking for me, because AI said nothing can replace empathy and human interaction. AI itself mentioned some of specialties that is more likely to be threatened by AI in the future. For example, like dermatology, pathology, radiology. I think just because it's more like it's of the job itself, it's more like interpreting things from pictures, or something that I think AI can do in the future, or maybe like can do better. But for something that needs more human interaction and more like, you know, like fast-paced decision, I don't think AI can replace that. Emergency medicine, it's very unlikely AI can assist, but AI cannot replace the emergency medicine. AI cannot replace psychiatry, because you can't, there is nothing that can replace doctors' empathy or social interaction. Surgery, AI can help with this assisting technology, but again, the hands of surgeon is very different with computers. So yeah, it's not a threat to medical specialties, I think.
Thank you. So I hope that convinced everyone that you will not get out of job because of the advancement of technology. In fact, you then potentially could offer more advanced intervention to people. Yeah. So these days we do lots of robotic surgery. Okay. So when you talk to people that I'm going to use robot assisted procedure, people then always says, but you are still going to be there, right? Because, well, I'm not sure about your generations, but our generations, we still trusting people more than letting a machinery to actually do something inside your body. Okay. So, but I'm not sure about Aisha or Naura generation later on. You probably would rather have robots to do your operations, but people these days, they still want a human being behind the robots to actually do the operation. Okay, so I think the trend would be the same still, but obviously yes, some of the medical specialty that relies much on pattern recognition, like radiology, pathology, they are being helped a lot by AI, but still they still need clinician and doctors to run the services. Okay. Any questions at all? No? Ada pertanyaan, Mas Fahad? This. Oh, okay. Okay. Explain the steps. Okay, I will let Hani explain that. I think there are some other. So the situation would be someone had already completed medical school in Indonesia or abroad, outside the UK. How do you get to the UK? What are the process that needs to be done in order to be able to practice medicine in the UK? Is that correct? That's the question, yeah? Okay.
It's quite a long process actually. I think even for me, it took me around 2 years or so. So they have like the basic requirement. So the medical school needs to be acknowledged, but what we call EPIC, I can't remember what it stands for, but it's like more like the international organization which acknowledge the quality of medical school. So if the medical school in Indonesia, the institution is recognized by this EPIC organization, that you can apply.
Which at least until 2 or 3 years ago, all medical schools in Indonesia, including the private ones, are recognized.
Are recognized. Yeah, so that's fine. And
5 years, probably 5 years.
yeah.
We
Yeah, but now there are more the private medical schools open. The newer one, it's
but you know, like before 5 years ago, all medical schools in Indonesia are recognized.
yeah. And then the next step would be the English requirement. So IELTS, I think it's still the same. IELTS minimum of 7.5. So that's the overall band with the minimum 7, I think. But if goes to training, like foundation training, you need 7.5 minimal for all band. Or other tests, what we call OET, what is OET? Occupational something. So OET kind of like IELTS, but it's like B in medicine. So that's the English requirement. Once you're past the English requirement, you're able to register for the exam, what we call PLAB exam, professional something linguistic body. Sorry, I'm very poor in remembering things. So that's there are 2 exams here. So PLAB 1 is more like the theory one for the medical exam, and PLAB 2 is more the clinical skills. Equals is what we call OSCE. So finish with the English requirement, apply for PLAB 1. When you pass PLAB 1, then you can go through the PLAB 2, so that's for the clinical skills. When you pass PLAB 1 and PLAB 2, then you can register with General Medical Council here. But then again, they will ask like more requirements from Indonesia, like certificate of good outstanding from KKI, Konsil Kedokteran Indonesia, and like proof of internship, stuff like that. And once you secure your GMC, General Medical Council registration, we can find a job here to work as a doctor. And so that's basically it, to have the registrations. But if you want to apply for specialty training here, that will be another different requirements and different routes.
So for everyone who, sorry, yes, but yeah, please.
Other program study, there is like to study in university, there's like the degree apprenticeship. Okay, is there any degree apprenticeship for the medical?
In medicine?
Yes.
Yeah. Sure. Thank you for the question. So I'm just gonna add on Hani's questions. So basically, if you look at the GMC website, so General Medical Council website, there are informations about how to register. So Hani explained about the PLAB route to register, but you also can get other routes to register in the UK. You can go by clearing the membership exam. So say, for example, someone had done specialty training abroad as well. So they can just sit the Royal College of whatever specialty that they want. So if they get the membership, they can use that membership to also register with the GMC. So it doesn't have to be PLAB exam like Hani explained. It can go also through the membership exam. So like, for example, Hani is a psychiatrist, so there is a Royal College of, what do they call? Royal College of Psychiatry. So there is a membership exam. In order to be able to be a member, you need to sit the exam and pass the exam, not just sit the exam, but pass the exam. Like for me, it's the Royal College of Obstetrician and Gynecologist. So if you pass the exams, which normally membership exam is way more difficult in comparison to PLAB, but if you do clear them, you can register with GMC using that membership. That's another route of registering with the GMC. The other route is if you don't want to sit the PLAB, if you don't want to clear the membership exam, there are certain specialty in the UK who offer what we call as the Medical Training Initiative, or MTI. So these scheme are introduced, I think, few years ago. Lots of specialties, especially the ones with less trainees in the UK, they will offer lots of MTI spots. Normally, the MTI recruitments are organized by the Royal College of a certain specialty. Say, for example, if it is obstetric and gynecology, it will be organized by the RCOG. If it is anesthetics, it will be organized by the Royal College of Anesthetists, and so on and so forth. So if you go through the MTI scheme, most of the specialty would expect you to have some experience in that particular specialty, not necessarily completed your training, but you can train. So every specialty would have a different requirement. But then if you get that post, you don't have to have PLAB or membership exam. They will actually sponsor your registration with the GMC. So the Royal College will sponsor you to get registration with the GMC. And there so far, I think we had 2 Indonesian doctors came over under the MTI scheme. One was an anesthetist and one was pediatrician. So there were as far as I know, there were two MTIs from Indonesia. So those are the other route to be able to register with the GMC, and it is a very, very popular route, especially with our colleagues from India, Nigeria, Pakistan. There, lots of them came over to the UK through MTI route. Other schemes that I think not necessarily popular or easy to go through are some of the sponsorship. I'm not quite sure how that works, but I know some of the hospital trust, they can sponsor because they recruit directly. So they will actually sponsor the process of the registration. So you will still have to go through all the paperwork. However, they will sponsor you because unfortunately it is not the cheapest to do all these exams and all this registration, so that we actually sponsor you, but then you will have to work for them, if that makes sense. So you will need to sign a contract that you will stay with them for a certain period of time. Okay, now coming to Pak Hatta's questions about degree apprenticeship in medicine, yes, there is. So it was planned to be introduced last year in the new year, not new year as in new academic year. However, it got postponed because of some concerns regarding how they are going to divide the university time and the working time. So they have not agreed yet. So it was postponed. So it was going to be launched last year, but they have not. But the plan is there. So at the moment, they are, I think UK government is trying to increase the medical school places, I think by 5,000 a year or something like that. They are trying to push the numbers because obviously it is like a leaking tap. You know, like the medical. So I think it is a bit of irony, isn't it? Medicals. So I think lots of medical graduates from the UK then go abroad to work, and UK rely a lot from international medical graduate to come to work to the UK. But it is how it is. So they are trying hard to increase the numbers of the medical school, and one of them is by introducing degree apprenticeship for medicine, which obviously a lot of people was looking. Actually, a lot of people were looking forward to that because of the obviously the flexibility that it offers in terms of the the funding as well, because the hospital trust will also fund some of the education. Yes, and they were thinking to then like mimicking the specialty training at the moment. At the moment, all specialty training are actually paid for the trainee. So they do work in that particular hospital, they are being paid. But the money coming from NHS England, so that's a slightly different sort of organization where the money coming from. So at the moment, I don't think the degree apprenticeship for medicine funding coming from NHS England. I think that's coming from other buckets of money somewhere. But yeah, but I think they were saying that it is going to be launched this August, September intake. Yeah. I hope that answers that questions. Any other questions? Yes, Aisha.
So, you know how there was the option of doing like a degree before you go into like medical school, right? What's like the benefits of that compared to like, you know, finishing your A-levels and then going into like medical school?
I will ask Kak Alia to answer that question because she does that.
Well, if you really want to do medicine and you're sure that there is no benefit, but it's just because you might not get in the first time. So if you want to, if you don't get in the first time, you can either reapply the next year, or you might just do another degree, which I did. But I guess if you're not that sure if you want to do medicine, then it's a good opportunity for you to like do another degree and like explore different career options, because like medicine, that option will always be there, but you know, you might decide during those 3 years that, oh, I actually prefer, you know, doing something else, or because you know, like medicine is quite a commitment. Like if you do medicine, it's 5 years and then you do training, and if you're not that sure and after medicine you decide, oh, I want to work in a bank, like you could have saved 2 years and done a 3-year degree and then just gone straight into working in a bank. So I guess if you're not that sure, you can maybe do another degree.
Does that answer questions? Yeah. So in the UK, you don't have to, but in the US, if you go to medical school in the US, you have to do another degree. Yeah, but not in the UK. And as Kak Alia said, there are a lot of people actually going into medicine after not just doing a degree, they actually worked in their particular other field for years. I've known someone who like went into medicine in their 40s because they've been working as a, I think he works in a finance for like 15 years and then decided, actually, I want to go to medicine. So he did. And I've got one of a very close friend of mine. She was a project manager working in conflict area and deprived area in rural Bangladesh for I think like 10-15 years, and then she decided that she actually wants to do medicine, so she went into medicine in her 40s. She did that. So it is a possibility. As Kak Alia said, if you're not sure, you're very lucky to live in the UK and have that opportunity to actually have your options open. If you were in Indonesia, you missed the boat, unfortunately. But here in the UK, it is very flexible. Okay. Any other questions? Nora, do you want to ask questions? No? Did I convince you? I think probably this is for everyone who are considering whether they want to do medicine in terms of choosing the A-level subjects. Okay, do you have any advice, say for them who is already like 95% sure they want to do medicine? What subjects would you suggest them to take in A-levels? And for them who not very sure yet and they want to keep their options open just in case they actually want to do something else after A-level.
So with me, I chose maths, biology, and chemistry, which might be seen as like the medicine trio. But I know that maths can be replaced. So if you're not a huge fan of maths in like GCSEs, I would there's like you can take a lot of other subjects. I know that when going to medicine, I'm 99% sure that some of the universities might need biology as an A-level. I'm not too sure if you need chemistry as an A-level, but I would say having biology is quite a good A-level to have. I would say,
yeah, I did biochem and maths. I think biochem and maths is like a good combination because different unis require different things. Some want all three, some want just chem and maths, some just want bio and maths, bio and chem. So taking those three. Some unis want maths. So I think if you definitely want to do medicine and you want to keep your options open, then you should do all three. But I think most people do 4 now. So if you're not that sure, maybe do like a humanities as your 4th one instead of doing like, unless you want to do engineering, I wouldn't choose physics. I would choose something else.
Kak Handi didn't do the A-level, so now in terms of you were saying that there are the UCAS application on top of the UCAT and BMAT. So you said work experience and then other work. So a lot of people asking, how do you get work experience, and does it have to be in hospital? Can you join in sort of like this type of sort of like online sort of talk, or there are lots of companies and providers at the moment also offering the same sort of virtual work experience? What's your advice to them?
yeah, so I would say that I undertook kind of like virtual work experience to begin with, just to get some knowledge about medicine. I would definitely recommend researching some of the unis. They may have summer programs or programs you can get involved with, where you can go to the university, see what it's like to be in the medical school, to give you a bit more insight. You can also gain hospital work experience, which I know for me personally it took a really long time, having to email back and forth with the hospital, and if it doesn't, I would say with in interviews and personal statements, it's not a requirement to have hospital or clinical work experience. It's more generally the skills that you learn from those experiences that you could possibly get in your local community. So you can go to your local GP if they have any time to let you in to see any consultations. But there's also sometimes my friend also did a care home, which I think is a really good experience to have, having built your communication and your interpersonal skills. So I would say that requirement in a hospital setting, you don't need to, but but having those skills and being able to reflect on them and how you can put that in a clinical setting is quite beneficial.
So for work experience, I would say you have to probably start doing it like after your GCSEs, because you apply before you start year 13. So before year 13, you want to already have that work experience. So normally it's in the hospital. You should I mean, it will be good to have one in the hospital so that it's more for you to see if you actually like the job, and you can talk about it, and it's more it's more for you to see if you can handle like being in the hospital and you don't mind the work. But then there's also like a more long-term work experience, and it can be anything. Like some people do care home, like even volunteering with like children, or like in your local community, just something that shows that you're committed to something, and you're committed to a role that is involving other people and interacting with other people. But for the hospital experience, it can be quite difficult. I think if you know any doctors, like your parents' friends, like try like contact them, because it can be quite difficult to apply to a hospital, because they might not reply you, and it can be quite difficult sometimes.
Thank you. Any other questions? Yeah, Aisha.
So, generally, between like the subjects biology and chemistry, is there one that is like typically more, I'd say, like significant than the other? Because personally, like I'm like much more into biology than I am into chemistry. But from what I've been hearing, like other people have been telling me that for medicine, chemistry is like the most important, which like kind of in some sense it does sort of put me off, because like I have like a much more love for biology than I am with chemistry. So would my options be sort of limited if I went into more of like a biology route for like medicine and stuff?
Yeah, so I would say with having experienced my first year in medical school, I would say that the topics covered in the lectures are more biology based in terms of like physiology, what's happening in our bodies, as well as the anatomy. So having that kind of having like, I would say, like a strength in biology and an interest, it's very, very helpful. We do like we do cover chemistry and like biochemistry, where it's like a bit of an overlap, rather than like we don't technically learn like the chemical symbols like we do in A level. So it's not that much in depth with that chemical element. But I would say in terms of what I experience, I would say biology is quite more heavier than in chemistry.
I think if you don't like chemistry, is not really an issue. Just you can just choose the unis that don't require an A level in chemistry. So if you're already planning to apply to like 4 and none of them require chemistry, then you're not really limiting your options by not taking chemistry. But if there's a uni that you really want to go to and they require chemistry, then you'll be limiting your options.
Yeah, I hope that helps. And I always tell myself, lots of those subjects that you learn now in secondary school, later on in A level, and even if you go to medicine in medical school, when you actually work as a doctor, and especially when you then specialized onto a certain area, you're probably not going to use most of them. Okay, so as Kak Hani says, that's probably like most of them you need to know in order to pass the exam, unfortunately. But actually, looking back, you didn't realize that actually you retain some of those information. So when it is needed in the future, you just need to reread, and then, oh yeah, I know this. Oh yeah, I know this. Yeah, but I completely agree. Chemistry is not the end of the world if you don't like them. Okay, especially if you later on practice certain area of medicine that probably do not need to have a lot of sort of chemistry background, but definitely some knowledge would be beneficial. Yeah. Okay. Any other questions? No. Yeah, I think it's 3:45 now. I think if there isn't any further questions, I'm gonna close it just here. Yeah. Or any of you want to add anything before we close? No. great. So hopefully that is useful for all of you, not just everyone who attended here at Masjid IIC, but also everyone who also joined in online. If you do have more questions, we'll be more than happy to address those questions. Feel free to contact us through Kibar Youth. Also, if if any of you, especially the ones that graduated from medicine, already a doctor in Indonesia, for example, there are also other sessions that are being held by Dinda UK to discuss about how to go to the UK in order to work, as well as to have specialty training in the UK. So you can also join that as well, inshallah. So thank you everyone for all your participation. Inshallah that I'm hoping that it is useful, and stay tuned on the next Kibar Youth career seminar sessions, inshallah. When is the next one, Kak Adiba? Oh, Kak Adiba like Kak Adiba is going away, so but inshallah stay tuned. We will organize other career pathway. Please do send us your suggestion. We were thinking about doing the law, didn't we, Kak Adiba? But I don't know whether Kak Adiba will still be available by then. But inshallah we'll meet in other Kibar Youth activities and session, inshallah. Thank you all very much for all your attention. Thank you all for coming here today. Inshallah, let's complete our sessions today by saying Alhamdulillah, Alhamdulillahirabbil alamin, and istighfar, astaghfirullahaladzim, 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 and dua of closing our meeting and majlis today. Subhanakallahumma wa bihamdika, asyhadu alla ilaha illa anta, astaghfiruka wa atubu ilaik. Assalamualaikum warahmatullahi wabarakatuh. Thank you everyone.
Yeah. Why?
If anyone wants to play with my laparoscopy box, feel free to do so, okay? So I've got this laparoscopy box. So if you heard about keyhole surgery before, so this is what we use. Well, not this is what we use. We use, this is a proper instrument, okay? But this, laparoscopy. So laparoscopy, so basically, you know, like back in the day, if we were gonna operate inside your tummy, you have to cut you open, right? Yeah. That's how you were born, by cesarean section, right? So these days, these days, rather than cut your body open, like widely, yeah, or making like whatever, like big cut on your tummy, we use keyhole surgery, yeah? So keyhole, so we only cut like really tiny cut. So normally it would be about 1 centimeters on your belly button cut, and then I'm gonna put a camera inside your tummy, yeah? So this is like a camera. So this is obviously not the real one, but this is, the concept is like this. So we put a camera inside your tummy so that I can see inside your tummy. And then I put another 5 millimeters cut. So that's half centimeters cut on the side. Normally, depending on what I'm doing, then I will put that cut, probably 2 or 3, yeah? And then I'm putting the instruments inside. So I've got the camera. Yeah, the camera, and then I will see on a screen. So this screen, okay, this is not connected, but then you will see on the screen, and then you're gonna operate using this very, very tiny instruments. So it goes. So this is the actual port that you would use. Okay, so this would go inside your tummy. Yeah, and then you've got the camera to see what you are doing, and then you're gonna put instruments inside, and then you operate. It's like playing games, really. Yeah. So, yeah. So this is what we do these days. Okay. So we kind of move away from doing big cuts on your tummy, because obviously it's not very nice to have a big cut on your tummy, right? The recovery time is very quick. Yeah. So back in the day, if I need to do operation, yeah, people would stay in hospital for days because they have big cuts on their tummy. So they have to recover, lots of pain. Can you imagine? You have a big cut on your tummy, yeah? These days, this type of operation, you can just come to hospital, have your operation, recovered from the general anesthetics for a couple of hours, and then go back and then go home, same day surgery. Yeah? So we kind of like, we don't keep people for too long in hospital anymore, okay? Now, unfortunately, for cesarean section, the type of surgery that your mom had, in order to have you, we are not able to do it this way because we have baby to come out, right? So if I only have that big of cut, and the baby will not be able to come out on that cut, yeah? So these are more for other, what we call as a gynecological surgery, for example, yeah? Like if you have cyst, ovarian cyst, or certain gynecological cancer, if I need to remove your someone's womb, I can do that, yeah? How to remove the womb? So it depends. The womb can, when you cut, and then it can be pulled down from the vagina. That's one way of doing it. Or you then can, what we call as a morcellate. So you basically cut the specimen into small pieces and then retrieve it, or put it in a bag and then pull it out from here. From here. But then you need to cut it into pieces. So we can't do that with baby, can't we? No. So no, unfortunately, cesarean section, we still have to cut them open. Yeah. But other surgeries, most of the surgeries these days, we do it with the keyhole surgery. Okay. So it is very important for you when you do keyhole surgery. That
Hah? Oh. 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 B. La. 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 Four. Cek. Hai. Hai.
Biar ketularan jadi dokter. Biar ketularan.
So there's a very skill. There is a skill that you need to learn. However,